Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 52 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at the facial nerve, cranial nerve 7. The facial nerve is the sole motor supply to the muscles of facial expression and some other muscles derived from the embryonic second pharyngeal arch. It provides sensory innervation to the taste buds in the anterior two-thirds of the tongue via the chorda tympani. It also supplies parasympathetic secretomotor fibers to the submandibular, sublingual, and palatine salivary glands, as well as the glands of the nasal cavity and the lacrimal gland. Let's next take a look at Bell's palsy. This is an idiopathic unilateral facial paralysis, accounting for 75% of all facial nerve lesions. The terminal branches of cranial nerve VII may be injured by parotid cancer or during surgery to remove a parotid tumor. In infants, the facial nerve may be injured during a forceps delivery because the mastoid process has not yet developed and the stylomastoid foramen is relatively superficial. Let's next take a look at the lesions of cranial nerve VII. Symptoms of cranial nerve VII lesions vary based on the lesion's location. Bell's palsy manifestations include the inability to close lips and eyelids on the affected side, dry eye due to lack of lubrication, and difficulty whistling, blowing a wind instrument, or chewing effectively. Facial distortion occurs due to contractions of unopposed contralateral facial muscles. A lesion within the facial canal can also affect taste from the anterior two-thirds of the tongue via the chorda tympani, and cause a loss of secretion from the submandibular and sublingual glands on the ipsilateral side. Alright guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 45-year-old woman presents with a sudden onset of facial drooping on the right side, inability to close her right eye, and loss of taste sensation on the anterior two-thirds of her tongue. She also reports decreased tear production in her right eye and a dry mouth. Which of the following structures is most likely affected? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is E, facial nerve, cranial nerve 7. The facial nerve, cranial nerve 7, is responsible for motor innervation to the muscles of facial expression, sensory taste fibers to the anterior two-thirds of the tongue via the chorda tympani, and parasympathetic fibers to the lacrimal and salivary glands. The patient's symptoms, including facial drooping, inability to close the eye, loss of taste, and dry eye and mouth, are indicative of a lesion affecting the facial nerve. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, glossopharyngeal nerve, cranial nerve 9. The glossopharyngeal nerve primarily provides taste and sensory innervation to the posterior third of the tongue and motor innervation to the stylopharyngeus muscle. It does not affect the muscles of facial expression or the anterior two-thirds of the tongue. B, hypoglossal nerve, cranial nerve 12. The hypoglossal nerve controls the motor function of the muscles of the tongue. Lesions would result in tongue deviation and atrophy, but would not affect facial muscles, taste, or glandular secretions. C, mandibular branch of the trigeminal nerve, cranial nerve V3. This nerve provides sensory innervation to the lower face and motor innervation to the muscles of mastication. It does not innervate the muscles of facial expression or provide taste sensation. D, maxillary branch of the trigeminal nerve, cranial nerve V2. This branch supplies sensory innervation to the midface region but does not affect motor function, taste, or glandular secretions. All right, now that we have covered this question, let's move on to look at the next question. A 50-year-old man presents to the clinic with a sudden onset of facial drooping on the right side. He reports difficulty closing his right eye, loss of the nasolabial fold, and inability to smile on the affected side. Additionally, he mentions a recent loss of taste sensation on the front part of his tongue on the same side. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C. Bell's palsy. Bell's palsy is characterized by sudden unilateral facial paralysis affecting the muscles of facial expression due to dysfunction of the facial nerve, cranial nerve 7. The symptoms include inability to close the eye, drooping of the mouth, and loss of taste sensation on the anterior two-thirds of the tongue. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Trigeminal neuralgia causes severe facial pain along the distribution of the trigeminal nerve, cranial nerve 5, not facial paralysis. B. A stroke can cause facial paralysis, but it often involves additional neurological deficits such as limb weakness or speech difficulties, and typically does not affect taste sensation in this manner. D. Myasthenia gravis is an autoimmune disorder that causes fluctuating muscle weakness, often affecting ocular and bulbar muscles, but it is not typically associated with sudden unilateral facial paralysis. E. Acoustic neuroma, vestibular schwannoma, can affect the facial nerve, but it typically presents with progressive symptoms, including hearing loss and balance issues, rather than sudden onset facial paralysis. All right, now that we have covered this question, let's move on to look at the next question. A 52-year-old man presents to the clinic with complaints of right-sided facial weakness, inability to close his right eye, and decreased tearing in the same eye. He also reports a loss of taste on the right side of his tongue and dry mouth. On examination, there is asymmetry in his facial movements, with drooping of the mouth and an inability to raise the eyebrow on the right side. Which of the following is the most likely location of the lesion in the facial nerve? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, in the facial canal proximal to the chorda tympani branch. A lesion in this location would affect all the functions of the facial nerve: motor function of the muscles of facial expression, taste sensation from the anterior two-thirds of the tongue via the chorda tympani, and parasympathetic supply to the lacrimal and submandibular sublingual glands, leading to the symptoms described. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. At the stylomastoid foramen. A lesion here would primarily affect the motor function of the muscles of facial expression, leading to facial weakness and asymmetry. However, it would not affect taste sensation or lacrimal and salivary gland function. B. Within the internal acoustic meatus, a lesion here could involve both the facial and vestibulocochlear nerves, cranial nerve VIII, potentially causing hearing loss and balance issues along with facial paralysis, which the patient does not report. C. At the geniculate ganglion. A lesion at this location could cause similar symptoms to those described, but would also be expected to cause more severe pain and potentially affect other branches of the facial nerve, leading to more widespread sensory deficits. E. At the junction of the facial nerve and the parotid gland, a lesion here would likely result from a parotid tumor or surgery and would primarily affect the terminal branches of the facial nerve, leading to facial muscle weakness. It would not typically affect taste sensation or lacrimal salivary gland function unless more proximal involvement occurred. Alright guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is Fixer Med signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.